Next is success of the program in placing students in internships and jobs. You want to know this. So before you go there, you want to find out how good were they at getting people into their internships. And again, this is really for the doctoral programs in clinical and counseling psychology. Okay. How successful did they do in getting people into the fellowships or supervised experience? So if it's a master's level, it'll be a supervised experience. For the doctoral programs, it's a postdoctoral fellowship. How good a job did they do? Are they getting you into these kinds of training programs? Do they have a feeder into those? Or is it like, hey, you finished your time here, good luck to you? You don't want that. You want the ones that have the feeder. Finally, how successful are they helping you get a job in academia or clinical services? When we do the program evaluations, like APA program evaluations, I didn't mention it earlier, but I am APA site visitor. What that means is I'm one of the people that gets sent out by American Psychological Association to evaluate programs. And specifically, my specialty area is evaluating internships to see how good the internships are and whether APA is going to accredit the internship. So I actually go out there. It's a team of us. It's either 2 or 3. It depends. It's usually 2 in internships. And we go out and we interview everybody on the internship. We sit around and watch it for a couple of days. We review files and charts and do all that to evaluate how good is that program or not. And so one of the things that we're looking at is how good do these programs do at getting people to where they want to be? So if the program says we train people to be academicians, then what we want to know for accreditation purposes is, did you get people into academic jobs? If they say we specialize in hospital-based treatments and the people who come out of our program are great at providing hospital-based treatments, then we want to know, did you put people in hospital-based treatments? We don't expect everybody to go into that because things change. Sometimes you start out as a researcher and you realize, I really would rather be a clinician. Sometimes you're saying, I think I would love to work with children. And then you go partway through and you go, I don't want to do child therapy. I want to do something else. Okay. So we know that people change and so you may say, I want hospital. And then you end up saying, no, I really like outpatient work much better. Okay, fine. So we don't expect, and accrediting bodies do not expect everybody to go into exactly what the place trained necessarily, but that should be where we're getting people, and they should be doing a good job of getting them there. We don't want to see people graduating from a program and then nobody's getting a job afterwards. We want to see, did the program do what it could? It can't do everything, right? So most of it's up to you. You've got to have done a good job and you've got to be a good job hunter. You've got to do those kind of things, but you should get a lot of support from your mentor, from other people in the program. That should happen. And that's what you need to ask. How successful are you at getting people into jobs and the jobs that they are trained for after they finish their doctoral program or master's program?